Alice. Well, it's a pleasure to be here. I was just telling Alice that I started off my career here working at Jamestown. Is anyone here from Jamestown? No one. Oh yeah, so it'll be over a decade ago, I did my internship, a big portion of my internship at Jamestown.
You wouldn't know. I'm from Jamestown.
You're from Jamestown. Awesome. Not Peterborough? Everyone says they're from Jamestown that way. But no, it's good to be here. I'm going to talk about skin cancer. I'm going to keep it pretty sharp and snappy because it's getting late. I guess the question, why talk about skin cancer? Because it will happen to almost everyone in this room. 80% of basically white blokes will get skin cancer. I'm probably going to get a skin cancer. That's how common they are. 75% of people will obviously get a cancer that may very well become something that needs to be excised. So surgery is going to be something you're going to need for your skin cancer as well. And it happens to everyone. I mean, obviously there's a few notable people. Hugh Jackman, he's had about 4 cancers removed from his nose. Deborah Sutton, there's a whole bunch of Aussies that are quite prominent that have had them. But you don't have to be prominent, you don't have to be rich to get skin cancer. Farmers are going to get them, shearers, everyone that works outside. And you know what? It's us blokes that tend to work a lot outside. And that's why we're more prone to get skin cancer. You know, in fact, this is just some general stats I was alluding to earlier. But not only do we get more skin cancer, we're more likely to die from it. So when it comes to melanoma, which we'll talk a little bit in a second, you're 2.5 times more likely to die from it than a woman. Now, it's important for both genders, but blokes, who should we blame? Why are we dying 2.5 times more often than women? Who should we blame? Come on, who should we blame? Who? Ourselves, exactly. You and I, we can only blame ourselves that we're dying at a higher rate from melanoma because we just don't look after ourselves. And if we don't look after ourselves, no one will. So I guess how does it start? You know, skin cancer is not like an all or nothing. It's not like you have beautiful skin cancer. The truth is there's lots of little steps. And because there's so many little steps, you have a chance to intervene and get on top of it before it becomes something that you need to see me about or someone else. And the way it often starts is with these solar keratoses. Now people call them sunspots. Obviously solar means sun, so you can call them sunspots if you like. But solar keratoses, nearly everyone's got them, and I bet you've got someone, most of you here tonight. And I'm sure if you don't have some of your relatives do. You see on the top of the head where it's a bit scaly, a bit rough. On the back of the hands, a bit scabby, a bit rough. For someone that are a little bit younger in the audience, sometimes it starts off with a bit of scale on your scalp. Now, have you ever felt your forehead and it's just a little bit rough and you think, oh, it's a bit of dermatitis or a bit of irritation? It probably isn't, actually. It's probably these solar keratoses, which are this kind of middle ground between good skin and skin cancer. And if you've got them, they're worth treating. They're worth treating. I often liken them a little bit to like specks of rust in the car. You know, when you got a speck of rust in the car, you can easily ignore it because, you know, it's a speck of rust. It's not going to come too much anytime soon. But if you don't deal with that speck of rust, you know, you're going to look like my grandfather's car. You're going to have a huge hunk of metal missing from the door. And you know that's going to take so much work to fix. So my point is, get onto it earlier. Deal with your skin when you start to get some of those little rough spots. Get them treated. And they can be frozen off. They can be treated with cream. There's lots of ways you can treat them. So get ahead of the game. Don't wait for cancer, all right? So pay attention to those sunspots. So if you leave a sunspot, what will happen? It'll get more and more irritable, more and more scaly. It'll start getting a little bit sore. You might have a shower and think, well, actually that feels a bit sore when I dry myself. There's a good chance that sunspot now has become a cancer. Now, I tell people that skin cancer is like fruit. There's just so many different types. I'm just going to focus on 3 of them. SCC, BCC, and melanoma. All skin cancers also have very different behaviours. I often tell people they're like children. You know, some kids will sit in the corner and read a book, and you'll have others that will just trash the place. Skin cancer is the same. You'll have some skin cancers that are really slow, very indolent, very lazy tumours. They won't do very much, so you don't have to rush too much to act on them. But others will just wreck the place like melanoma would, which we'll talk about in a second. So let's talk about basal cell carcinomas. Has anyone here in this room actually had a basal cell carcinoma? A few nods. This is the most common skin cancer and the one you're most likely to get, very much related to sun exposure. So you're not going to get this on the back of your thigh really, or on your scrotum. It's going to be on your face, your neck, upper back, forearms. Very much related to sun exposure. What's good about these? So it's a cancer, that's bad, but what's good about it is they don't metastasize, which means that they don't spread to your lymph nodes. So what you see is what you get, and so you'll have a spot that starts off like that, it'll just gradually get larger, and then usually the time that I see people is that when they notice it actually bleeds a little bit or it kind of hurts a little bit, that's when they usually come to me. Like for example, that one on someone at the moment probably wouldn't hurt you, wouldn't bother you at the moment. It's a perfect time to cut it out because it's nice and small, but eventually you'll find that in the centre it'll begin to erode, get a bit black and scabby, and you go, okay, this is now progressing. These need to be cut out. But this is the good skin cancer, so to speak. The other one that I'm sure some of you also have had in this room, because this is also very common, is squamous cell carcinomas. What makes these a little bit more different is you can see how this has got a bit of a horny kind of surface, a bit crusty, which is quite different to the basal cell carcinoma, which is very smooth and glossy. Squamous cell carcinomas are a little bit more dangerous. They do metastasize. So if you leave it alone, say you have something like that on your leg and you leave it alone, it'll get bigger, but if you give it a chance, it'll then spread to your lymph nodes and then spread throughout your body. So a little bit more vicious. Something like that definitely needs more attention. A BCC needs attention, but not so urgently. This needs to be cut out fairly promptly or treated fairly promptly. Again, really common, really common. Melanoma. We've all heard about melanoma. That gets the most press, but obviously it's not the most common. It only represents about 4% of skin cancer. So it's not anywhere near as common as sometimes people think it is. But the reason we harp on about it is that it's vicious. Like it wants to kill you. It wants to kill you. And the name of the game with melanoma is pick it up. And you know, it's sometimes very tempting to rely on other people to pick it up for you, but most of the time, and we've studied this several times, 70% of melanomas are found by you, by us. You find it yourself and you show it to your doctor and it gets attended to. So you have a big part to play in finding your own melanoma. A lot of this is intuitive, but I want to go through it. So, you know, obviously moles come in all shapes and sizes. There's lots of different types, we grade them in different ways, but what is usually a sign of a nice, healthy mole is it's nice and symmetrical. The colour is pretty uniform. It doesn't look like it's bleeding or hasn't been irritable or itchy. Just looking boring. You want a boring mole. Alarm bells should come into your mind when you see moles that you can see here a little bit black on the edges. I mean, this is completely, even to your eye, this looks completely chaotic, completely asymmetrical. These are the features. If you've got a mole that looks like that, show it to someone. You've got to get that seen to and probably just get it cut out. See how this is pink? You won't believe, what makes it really, I guess, tough, very hard for all of us, is that a fair portion of melanomas are actually pink. Everyone thinks melanoma has got to be black, and most of the time they are, but often they're pink. So never, if you've got a pink spot that's not quite right, it's sore, it's bled a few times, and someone said to you, no, it's fine, it's fine. Don't just say it's fine. It could very well be one of these, you know, pink or amelanotic melanomas. So keep that in mind. Yeah, we've touched on that already. So I guess the reason that you want to do all this, I'm going to put up a few gory photos. Is that all right? I can't put up gory photos over here. I can't put them up anywhere. So this is a chap I saw not that long ago who had a mole on his face. Didn't get seen to, thought it'd be fine, and comes to me a few months later. And this is the same, that's that mole that's just spread across his face. So this is a locally invasive metastatic melanoma. What do you think happened to this guy? 3 guesses. Yeah. No way he can be saved. But it started off with a mole on his face, you know. And I know we're all busy. No matter what your work of life is or what you're doing, we're all busy. And it's so easy to kick the can down the road and think, oh yeah, it's probably been there for ages. No. Get it seen to, I said, because no one else is going to make you see a doctor or get it seen to. And the reason we die so quickly from a lot of these things as guys is because we kick the can down the road. All right, so I want to show you a couple of benign things that often get mistaken for melanoma. Because, you know, often people show you stuff and you think, oh, should I be worried about that? I don't know. This is something that all of us are going to get. And I'm sure if you don't, your mate does. You have these, what we call seborrheic keratoses or age warts. I'm sure you've seen a few backs like that where they cover these like warty brown spots. Often you might have a few on your face. As you get older, you often get quite a few of these like this on your temple. and we look closely, they look warty. They look warty. These are so benign, so benign. I'm going to get lots of them. Everyone gets lots of them. A little bit genetic, very much related to sun exposure, but these are not cancerous. So don't stress about those at all right? They occasionally get itchy because they dry out, but they're not cancer and they have no cancerous potential. Now, treatments, surgery, I cut out about 1,500 cancers a year, and there's lots of people liking to cut out lots of skin cancer, and it gets tiresome for people. I'm sure if you've had a few things cut out, it's not fun. Even if it's a small excision, it'd be nice if there are alternatives, and the future is very bright. I think that in 10, 15 years, there'll be a lot less skin cancer surgery than we are doing now. So just a few options I want you to be aware of, because there's going to come a time you want to have something treated or you need something treated. And it's good to know what options do you have other than cutting things out. So there's a few chemotherapy creams, and they've been around for a while, but they're getting better and better. And they're creams that we can use for cancer that's a little bit thin, or is thin. And really quite clever technology. So if you have a thin skin cancer, there's some creams that can do it. Did you put your hand up? No, yeah, cool. Radiotherapy. Now, radiotherapy, it's always like, it has those awful connotations. You think, God, you remember your grandmother having radiotherapy in her lung and how bad that was. Things have changed so much. Radiotherapy is actually quite cool. It can work really well. I think what's bad about it is it doesn't really work in places like this because it's really labour intensive. If your GP says, think about radiotherapy, it's a lot of driving. So you need about 15 to 20 treatments, if not more. That's not really plausible out here. Brachytherapy. So this is a new technology, and I hope to have it at Flinders very soon. And you may actually see it on Channel 7 only like a couple of weeks ago. So we have a cream that has a radioactive isotope in there that releases energy, and we place it on the skin surface like this. So you can see the picture probably doesn't shot nicely, but there's a cling film, a bit of film on the skin, and there's a tumour that's been outlined with a pen. And we put this cream on there that contains rhenium, which is an isotope. And that isotope gets into the skin and kills a tumour over a period of about 6 minutes. And then it heals up beautifully. One treatment. So again, not going to be straight away available out here and so on, but 5-10 years, this will become mainstream. So surgery won't always need to be the only thing you've got up your sleeve. Injection. So some people have really bad cancers on their head and neck that aren't resectable. I'll inject them with drugs like 5-fluorouracil and methotrexate. So there are some injections I can inject into tumours to make them regress and go away. So that's another option. And of course, as I'm sure you've heard about on telly a lot, all those fancy immunotherapies for cancers of all different types. These are just drugs that are trying to get your own immune system, if you like, to kill your own tumour. And that is the future as well. I'm more than happy to explore those more in detail afterwards. You can come to me. So how do I look after myself? All right, this is an important one. So, look, lifestyle is really important. We know if you eat well, you're setting your body up to be able to detect its own cancer and deal with malignancy and avoid things either starting or progressing. Nicotinamide. Who's heard about nicotinamide, or what is nicotinamide? Does anyone know? It's just basically like vitamin B. We know that if you take vitamin B, or nicotinamide, which is a version of it, morning and evening, you get it from the chemist, over the counter, cheap as chips. It reduces your skin cancer risk by 23%. 23. Now, that's pretty cool for something that you get over the counter from your chemist. So I would say for anyone here that's getting a lot of skin cancers, or just about to, or if you've got a friend that's getting lots of skin cancers, tell them to read about nicotinamide, well used. I use it at the Flinders Medical Centre. I chair the high risk cancer unit and we use it on our patients there. It's cheap, it's over the counter, 1 tablet in the morning, 1 tablet at night, and it reduces skin cancer risk by almost a quarter, which is fantastic. So I do recommend that. Now,
does that come in Vegemite?
Yeah, it does. It does a little bit, but you'd have to eat a lot of Vegemite. But that is a part of a good lifestyle. I think if you're malnourished, you don't have those vitamins in your system, for sure you're making yourself more vulnerable to cancer. So Vegemite, for sure, it's a good part of a healthy diet. Protect your skin. Look, I grew up on a farm down the Khoury Peninsula, and I'll be the first to admit, when it's hot, it's dusty, wearing long sleeves, having sunscreen on your face, it's hard work. It's hard. And all you can do is your best. That's really all you can do. But I do think that long clothes is the way. Sunscreen, as I said, it's hard sometimes to put it on. and it wears off. So you can put it on at 8 o'clock in the morning, but by lunchtime it's not doing very much. But if you wear a long sleeve shirt, collar up, it's going to serve you well throughout the day. So you have to start habits. If you're not in the habit of wearing a long sleeve shirt, long pants, you got to start. And I don't think you need to go and buy anything fancy. You know, often you'll see these cancer websites selling, you know, expensive shirts and blah, blah, blah. Nah, look, I don't, you can get something from Big W, frankly. Some loose shirts from Big W, that'll be enough just to block out some of the light. Really, really important. You know, sunscreen, you know that. I'll talk a little bit about it more in a second. Lip balm. You know, especially for the fair guys in this room, which is most of us, or most of you guys, I'm a little bit darker than you. The lips cop it. The number of cancers I cut from lips is huge. And it always tends to be the farmers and the tradies, the chippies. Their lips just get baked, and it's the lower lip. So we're really good at putting sunscreen on our noses and the tops of our ears, but our lips, we let them just get cooked. So I do think you should have a nice lip balm that's at least 30 or 50 plus. Again, they're really cheap. Have them in the ute, have them in the tractor, have them around the place, in your toolbox and so on. Glasses. You know, take photos. You know, our memories are shocking. You know, you look at a spot, you think, oh, yeah, not sure, has it been there for long? I don't know. Take a photo of it. We've all got cameras on our phones. Take a photo of it. Look at it 6 weeks later. If it looks worse, you think, shivers, all right, I better get the scene too. If you just rely on your memory, think, no, it's just the same as last time. No, it's not worth it. Just take photos. It'll help you make a decision about what you're going to do with your spots. See your GP. You know, I'm a dermatologist, so I see the kind of the tough problem, you know, the challenging situations. But a good GP can solve most of your problems. You don't need me most of the time. And there are some great GPs out here. So I think get yourself keyed into one and trust them. There's lots of skin cancer doctors going around the place. They're a bit hit and miss, to be honest. There's some great ones. There's some, you know, entrepreneurial ones. But I think just your family GP is the person to go to, and they'll tell you if that's something they can fix or send you one. But they can fix most things by far. And look after your friends. You know, the number of people I see that come see me because their mate said, oh, bloody hell, just go and get it sorted, you know. And I think you all have that role. You know, if you got a mate that's still got that spot on their nose that's been, you know, it's been bleeding since you last saw them 2 months ago, just tell them, mate, just get it fixed. This is ridiculous. Because, as I said, we're all busy. You can't think, oh, no, I'll leave it. It'll heal up. So advocate for your friends and your mates. Now, sunscreen. Just a little bit about it. So, you know, we're lucky in Australia that we regulate this a little bit, because you have to be confusing your products that say 15 plus, 30 plus, 50 plus. And sometimes you'll have friends that bring something back from Europe, it says 100 plus. You think, oh, what should I buy? In Australia, we've capped labelling to 50 plus, because anything above that is really not, it's a little bit misleading. So if you see a 15 plus product, will knock out about 90% of the radiation, all right? So 93% blockage. 30 plus, 97, 50 plus is 98. 100 plus, for example, is only about like 98.2. That's why we don't actually label any more above 50. So my point though from this slide is you've got to get 30 and 50. Don't worry about high numbers, that's nonsense anyway. 15 is just too low. So if someone's giving you 15 plus, finish it, but I wouldn't buy 15 plus. And yeah, people often will say, oh, you know, I tan really well, I've got Dutch genes, blah, blah, blah. I tan, great, good for you. But that's equivalent of a 2 plus sunscreen. So it's great, but not great. All right, so don't rely on your ability to tan. Another key thing is, right, who has that sunscreen in their ute or in their car? You do? Yeah. Chuck it away. You might as well put on your grandma's lavender oil or something. Heat destroys it. It's very, very photolabile and heat labile. So what I mean by that is that it degrades really quickly. So if you have it in your car and it's been cooked there, 50 degrees on numerous days, you put it on and you might get 10 plus out of it. Yeah, and sometimes you experience that yourself. You think, I put sunscreen on today, but I still got burnt. And it's probably because the sunscreen was just dead. It was dead. And don't let it get too far from expiry dates. And it's easy. I mean, I've had sunscreen and I put it on, I think, geez, this expired 2 years ago. Time flies, but expired sunscreen dies. And light destroys it as well. Now, thankfully, a lot of the containers are impermeable to light, but sometimes people decant it into like clear containers and stuff. Light kills it, right? So it's not stable. Get small containers. Don't buy big, budget kilo packs. If you're not going to use it quickly, get small containers, use it frequently, and keep it in a cool place. So again, like in your toolbox, I don't know, where it's not in a hot car, basically. All right, so I guess my take-home message for you guys is that you are the masters of your own health, and it's a message to myself as well, and that no one's going to look after you except, I mean, there are going to be some people, your loved ones will, but truthfully, it comes down to you. You're the one that's going to pay attention to your skin. You've got to go and see someone about it, and if you don't, this is what ends up happening to you. This is someone I cut out a tumour of yesterday morning. This is a squamous cell carcinoma. So you remember I showed you 3 cancers? The first one's a BCC, which is a bit glossy. That's the good one. Then there's the one that's a squamous cell carcinoma, that's a bit kind of horny, and it has a crust. This is a squamous cell carcinoma. It's lost its horn because it's dying on itself, it's imploding. But this guy is probably going to get lymph node involvement. But if he'd seen me 6 months earlier, it could have been such an easy snip and clip job. So don't let this be you. That's my parting message to you. Don't let this be you. And key yourself in a good GP. And if you need a dermatologist, there's many good ones in Adelaide. All right? Any questions for me?
Should we be going to a skin clinic once a year or anything like that?
Look, I think it's very variable. I think sometimes it's worth getting a skin check just to set your baseline and see how your skin is. And if it's, a good doctor will then say, look, you know what, I think you're pretty low risk. See me in 5 years. But no, when people come to see me for an annual skin check, some people, I see some people every 12 weeks. They have so many problems. But I see many patients, I say, look, your skin's not bad. Come and see me in 5 years or something like that. So no, I don't think every chap needs a skin check each year. Sometimes it's a little bit overkill. As you get older, obviously your risks of skin cancer rise, and that may become applicable. But don't feel like, you're pretty young. I don't think you probably need a skin check each year. Yeah. Any other questions?
Is there any history with melanoma?
Definitely, hugely. Yeah. Approximately you're 25% more likely to get a melanoma if your first degree relative has, for sure. And that makes sense. A lot of cancers run in families: breast cancer, bowel cancer. There's a lot of there's a genetic component to it, and we know that well because children get melanomas, and you think, well, a kid has, how much sun has a kid had really? So they also got a genetic weakness to it, or someone that's 25 years old. Jared Ruffhead, for example, the footy player, got a melanoma in his lip. Really, how much sun has he had? It's probably more of a genetic, or a big component would have been a genetic weakness. Yeah. So yeah, you can blame your parents as well.